Hi everyone, and welcome back to Haven Within, Stronger Minds, Better Futures, the podcast where we have real conversations about mental health and what it looks like for teens today. I'm Stuti, a 10th grade student at Valencia High School, and this show is part of my Girl Scout Gold Award project. Mental health isn't just an abstract idea, it's something I've seen affect my friends, classmates, and community in powerful ways. That's why I created Haven Within, to give us a space to talk about the struggles that we face and the supports that really make a difference. I'm really excited to welcome back Dr. Katie Moore, a licensed psychologist who brings such a wealth of knowledge and care to these conversations. Her practice provides assessments for ADHD and autism, offers affirming therapy, and serves as a training site for future clinicians. Along with running her practice, she also supervises at a nonprofit clinic that makes therapy more accessible for people who might not otherwise have the chance. Her work has been featured in outlets like Forbes, Time Magazine, and Psych Central. When people think about ADHD, they often picture hyperactivity or distraction, but there's so much more to it. ADHD can look different for every teen. For some, it shows up in focus and organization struggles. For others, it's more about restlessness or difficulty with emotion regulation. And sometimes the challenges of ADHD get overlooked because people only see the stereotypes. In this episode, we're going to talk about ADHD awareness, what ADHD really is, how it impacts teens both in and out of school, and what kinds of strategies and support can really help. Dr. Moore, thank you so much for being here again and for helping me shed light on such an important topic.
Thanks for having me back.
So let's start with the first question, which is, how do you define ADHD from a clinical perspective, and what are common misconceptions that people have about it?
Yeah, so really with every mental health diagnosis, we define it by our diagnostic manual, right? The diagnostic manual is not perfect. Some of us don't even like it very much, but that is what we have to go on right now. So that is how we really define it. But we may define it differently than the general public does. So there may be some stereotypes or some stigma associated with ADHD that sometimes are associated with it, but it doesn't necessarily mean it's ADHD. So for example, maybe difficulty with motivation can be something that sometimes people associate with ADHD, and it can be ADHD, but it also can be depression, right? Sometimes people have these assumptions that people with ADHD, are lazy or something like that. That's so not true. It's completely not true. And that's not something that we would look at clinically, right? What we would look at clinically is it difficulty for you to start a new task, right? No matter if you know you need to start it, and even if you want to start it, is it hard for you to do that? So that may be something we look at clinically, whereas out in the general public, they might call that laziness, which it's not laziness, right? Mm-hmm. So I would say that's maybe how we look at that differently than how the general public would look at things. Mm-hmm. And there's also some, different diagnoses that we would look at as well, and I'm sure we'll probably get to that as we talk more.
Yeah, perfect. How does ADHD present differently in children versus in adults?
So it's really the way children present differently than adults in general, right? Mm-hmm. Like, kids are going to show up differently than adults are because they've got different levels of energy, they've got different things that they're focusing on, they've got different things that are happening in their life than adults have, right? So for a kid, inattentiveness might look like being really distracted at school and having a hard time focusing on their assignments, or maybe they're making a little extra noise in class because they're distracted and they're doing something else instead of their schoolwork, right? For an adult, that's going to look different. That's going to look like, okay, I have a big project due at work and I was supposed to work on it for the last 3 or 4 days, and it was really hard for me to get it started, but now I have a deadline and it's in 4 hours, and so I have to get this done, and so now I'm going to focus on it, mm-hmm. right? So that might look different in childhood versus adulthood. It's essentially the same symptom. It's just that kids show up differently than adults do. So that's the same with diagnoses as well.
Mm-hmm. And I feel like that, at least for me, I've mostly only heard of ADHD in kids, or the signs of it in kids where they're distracted. Mm-hmm. And I think that a lot of people don't realize that it can present differently for based on your age. So what might be there for kids may not be the same for everyone else.
Exactly. And there's multiple types of ADHD, right? So we used to have ADD, and sometimes people will still refer to ADD. ADD has not been in our diagnostic manual in this century. Like, it was last century that it was removed from the diagnostic manual. So like, I was still a child when it was removed, right? So now we have ADHD. And ADHD does not mean that every person who has ADHD is going to have the hyperactive type. It means it's a possibility. They may have hyperactive type. They may have inattentive type. They may have combined type, right? So it doesn't necessarily mean that everything's going to show up in everybody the same way. That's kind of the same with all neurodivergent related disorders, is they're kind of on a spectrum where we have a clump of symptoms that typically show up, but they don't always show up in all people. So we look for like, okay, are enough of these symptoms showing up that it's probably this thing, right?
Yeah. So what are some of the biggest myths that you think people have about ADHD in that case that you encounter, especially in your practice?
So I don't see so many myths that come into the therapy room as far as like the client is bringing the myth in. Sometimes a little bit, and that's usually them just not understanding kind of their own symptoms, right? But I do hear a lot of things that my clients have been told about their ADHD and about their symptoms. So they will have been told that they just don't care enough about their schoolwork, or that they're just not trying hard enough, or that they are just lazy, right? And that's not true. The reality is that nothing's true for everybody, right? But for some people with ADHD, they have to work twice as hard as somebody who doesn't have ADHD to do the same amount of stuff. And so it's not laziness, and it's not a lack of trying or a lack of caring. It's that their brain does not want to allow them to do the function that seems really basic to somebody who doesn't have ADHD. Their brain is just like, we're not going to do that, right? And so usually when I hear these kind of myths, it's not usually my client that's bringing them in. Sometimes it's my client that's bringing them in because they've been taught this about themselves. And so they're really struggling with their self-esteem and their self-worth, because for years now people have been putting this in their head, when in reality they just had ADHD and their brain was never going to do it, right? So their brain was never going to do it without any extra help or treatment, or maybe meds for some people, right? But their brain was never going to do it in the way that a neurotypical person's brain was going to just do it like this, right? And so they've been shamed for all this, and now we have to work through that in therapy. So if we didn't have those stereotypes and we didn't tell people those things, we didn't send those messages that we should all be able to do exactly the same thing in exactly the same amount of time, then we would probably have a lot less shame to work through in therapy.
And that's exactly why we're filming this, so that more people are aware of it, because a lot of people just say things without realizing like what effect it could have on other people, especially like people who have neurodivergent, like things like ADHD or like autism even. Like, so many people have so many assumptions, but they just don't truly know the facts. So.
Exactly.
So the next question I have for you is, how do you approach assessment and diagnosis to ensure accuracy and avoid mislabeling?
Okay, so for diagnosing ADHD, really it's not about whether people have the symptoms of ADHD. Typically by the time they come in, they already know they have the symptoms of ADHD. It's just whether ADHD is the thing that's causing those symptoms. So the symptoms that are in our diagnostic manual, right? We can kind of agree like, yep, this person has all these symptoms, but those symptoms could be caused by ADHD, or they could be caused by something else. So if I have anxiety, my anxiety is like really, really high right now, it makes sense that I might become overwhelmed and forget to do things. My time management might not be very good anymore because I'm so overwhelmed, right? So it might be hard for me to start new tasks because I have so many tasks that are in my brain because I'm really anxious right now, that it might be hard for me to start a new one, right? These are all also symptoms of ADHD. It's just that in this case, it's my anxiety that's causing those symptoms. It's not that I don't have the symptoms, right? PTSD can also be something that causes those symptoms. So if we think about like a second grader who's in class, right? maybe we think of that kid who like can't pay attention to their assignment for very long. So somebody walks in the door and they watch the person walk, to the front of the classroom and give the teacher a note. And then they watch that person walk back out and walk out the door. And then somebody drops their pencil and they look to see, oh, what happened over there, right? And then they hear some paper rustling and they look to find the, where's that sound coming from? And so a lot of people might look at that kid and be like, that kid totally has ADHD, right? Like, no question, that kid is super inattentive. For sure they have ADHD. And maybe they do, right? And we can do testing and figure that out. But also, if we know more information about that kid, and let's say now we add the information of knowing that at home, that kid's parents are fighting all the time, and dad is really, really angry sometimes when he comes home from work, and maybe he's not the safest person to be around, right? So if we add that information, that changes everything, because now the kid might not know why they're doing it. They may not know why they're looking up and looking around them all the time. But somewhere deep in their brain, probably in their amygdala, their brain is doing these things to protect them, even when they don't realize their brain is doing this. So when somebody walks in the classroom, their brain is looking to see if it's dad and he's really angry and we need to hide, right? And they're watching the whole time because at home they need to do that, right? And so their brain has learned that this is a protective thing to do, even if dad's obviously not there, and the kid may not even realize why they're doing it, right? The pencil maybe is looking around to see, is that something that's being thrown at me? Or is that something that I need to protect myself from? Maybe the paper is rustling is that somebody who's moving quickly across a room to hurt me, right? So somebody who has PTSD may have those exact same inattentive symptoms, but when we know this extra information, it might be, oh, yeah, you do have all the symptoms of ADHD, but it's actually PTSD. Mm-hmm. And so now we need to treat a different thing, because giving you medication for ADHD is not going to help your PTSD. It might make it worse, actually, right? Because now your brain is more active. So we want to make sure that we understand the root cause. Mm-hmm. So one thing we do when people come in for testing, and this is why if you think you have ADHD, it's important to go to a psychologist and ask for psychological testing, and then you can go back to your therapist for treatment and do treatment with your therapist. But the reason to get psychological testing is because we look at all those things. So we give lots of tests for lots of different things to try to figure out, like, okay, these symptoms could fit these 3 diagnoses. Which one does it best fit? So yes, those symptoms could be explained by this diagnosis, but do they really meet criteria for that? No. Okay, so we're going to cross that off the list. Now we have 2 left. Is it possible that they meet criteria for both? Or is it better explained by one or the other based on all these things that we know? So when we give a testing battery, we're giving the person questionnaires about themselves. We're usually, if it's a kid, we'll usually test a teacher and also a parent on what they're observing with the kid. We'll take a really thorough background history on the kid, including stuff like birth weight, and if they were born prematurely, and if there were any substances that they may have been exposed to at any point. So those things are all part of it. But also, is there trauma? How has this kid done in school? How have the grades been? How's the kid interacting with other people, right? So really thorough history on multiple areas of life, and that helps us as well to know what kinds of tests we need to give. We may give interactive tests where maybe you're clicking a button when you see or hear something, and that helps us to look for inattentiveness and whether that might be a PTSD kind of inattentiveness or an ADHD kind of inattentiveness, right? Mm-hmm. So when we do testing, we're extremely thorough to make sure that, yes, we know you have the symptoms. We can tell you that without testing. But are those symptoms related to ADHD, or are those symptoms better explained by something else? Mm-hmm. We don't know unless we do a really thorough testing.
Right. So in addition to what you just answered, I wanted to ask, how do co-occurring conditions like anxiety or learning differences impact ADHD diagnosis and treatment?
So, yeah, in addition to what I kind of have already said, We also might look at autism, right? So there's a really high co-occurrence of autism and ADHD. So if we, through our clinical interview, find that you may be having difficulties that are often associated with autism, then we might test for that. We might also test for like intellectual abilities when we test for ADHD. And that can, depending on where you go, it can be a very long test. Some of them are as long as like 4 hours, or it can be a short test. Some of them are as short as 15 minutes to test for the intellectual differences. So that's something that we can also look at in testing. In treatment, it's going to look like going to somebody who specializes in whatever the root cause of the problem is. So if we find, you know what, you do have symptoms that are often associated with ADHD, but they're actually better explained by anxiety, then you want to go to a therapist who specializes in anxiety for whatever age group you are or whatever demographic you are, right? If we find that it's PTSD, you're going to want to find a therapist who specializes in trauma, right? If it's ADHD, you want to find a neurodivergent affirming therapist. So really that's how that's going to look for treatment, is figure out what the root cause is and then go to the treatment that specializes in that root cause, because otherwise we're really just looking at symptom control, right? We're looking at just coping with the symptoms, but never really resolving the root cause of the problem.
Right. So what interventions or strategies have you found are most effective for managing ADHD symptoms?
So sometimes organizational stuff, so setting reminders on phones to do things, having a planner where you write things down, sometimes having something that is like a planner but it's something interesting, right? So I have clients who use the Finch app because it kind of gamifies getting the stuff done that you need to get done. So there's like a little bird that gets taken care of on your little app if you do the things you were supposed to do in the day, and that can, for some people, it's almost like it flips a switch where it's like, okay, I can do this because I care about my little game, right? And my little bird. And so I want my bird to be okay. And so I'm going to do the things I need to do. And it makes it a little bit easier because it makes it more like a game and less like this intimidating thing that I have to do, right? For other people, it's going to look like a literal planner where maybe they can just write things down, or maybe they write things down and they have stickers and drawings and fun stuff that they can color, right? For other people, it might look like having check-ins with somebody. So saying, hey, I have this goal. I'm really having a hard time addressing it. Can you check in with me? It can also be things like co-working. So, I've worked with clinicians who have ADHD, and we have something called clinical documentation we have to do, right? We have medical charts. We have to document things in somebody's chart when they come here. And sometimes that's the task that's the hardest part of this job because it's not fun, right? It's like not the fun part. The fun part is talking to people. And so if I have ADHD and my brain is like, I do not want to allow you to do that today, sometimes having somebody else do that with me can make it easier to do because it doesn't feel like so much a chore, right? So any way that we can make things easier for ourselves can be really helpful. On the other side of that, sometimes the distractibility is the problem. So getting things like noise-canceling headphones can be really helpful. Being in a quiet room can be helpful for some people, but also sometimes quiet rooms are really unhelpful for other people, right? So it's not a one-size-fits-all. We have to find the things that work for us. Fidgets can be helpful. For some people, not helpful for others. Coloring, like the really intricate coloring sheets, for some people is like really relaxing. For other people, they're like, that is the most anxious thing I'm ever going to do in my life, right? So we know not one size fits all with all kinds of things in life. This really isn't different. We have to find the thing that works for us, and sometimes we can do that on our own just by exploring. Sometimes we can meet with a therapist who might have really good ideas because they've worked with a bunch of other people who've gone through this as well. Just finding something that works for each person is really important, and then stick with the thing that works. And if it doesn't work at some point, it's okay to switch it up, right?
Yeah. Okay, perfect. And how do you usually help clients develop organizational, time management, or coping skills when you meet with them?
So kind of what I was just talking about is we really talk through, like, is this going to work for you? If it's not, okay, let's just look at why it's not working for you, right? So not just like, oh, okay, that's not going to work, let's move on to the next idea, but why is that not going to work? Because sometimes the thing that's going to make it not work is fixable, right? Like, oh, we could just make this adjustment and then it would work. And other times, knowing why it's not going to work also helps us to cut down on exploring a bunch of other things, because there's a lot of other things that'll fit in that category, right? So I work individually with each person to find what's going to work best for them. And sometimes that's a process, and sometimes it's a trial and error thing. And it's not always like I went to therapy once and they gave me all the answers and then I was good for the rest of my life, right? I wish it was. Like, I wish it was that. But sometimes it's not. So we just explore and we figure out what's working, and then we build. Once we know, okay, that worked a little, we build on that, and we build on that, and we build on that, right?
Yeah. So what role do you think that families, teachers, and workplaces play in supporting someone with ADHD? Like, if they need anything to, like, help them out, like, to tune out any distractions?
So I would say, even before we get to that point, if family or school or workplace is a little bit harder because there's some employment laws that could get people in trouble, but certainly family or school, if they're seeing like, hey, there's some red flags for this, bring it to the attention of the person and offer the assistance, right? Sometimes we don't know that not everybody's experiencing the thing that we're experiencing. Sometimes we just think, oh, this is hard for everybody, so I just have to power through it. And that's not always the case. So speak up. If you see that somebody's struggling with something, speak up and say, like, hey, is this something that's usually hard for you? You know, there's ways we can help with that, because sometimes people don't know to ask. So I would say, before we even go into strategies, that is maybe the number one strategy, is making sure the person knows that they can get help, and that there are answers out there, and that this thing that's really, really hard for them, they shouldn't beat themselves up, because it is actually hard. It's not just that they are not good enough, right? It is something that is actually potentially really hard for their brain to do. So I'd start there. From there, I would be really open with what accommodations are available, and also be open to the person telling you what accommodations they need, rather than you just being like, this is the box, you have to choose from this box and only this box, right? If the person's like, but actually this other thing would solve like all of these problems, maybe let's look at that, right? So be open to have this back and forth dialogue to customize things for people, instead of just a one size fits all. Because one size really doesn't fit all.
What are some ways that non-ADHD individuals can help reduce stigma or misunderstandings about it?
Talk about it, right? Be willing to learn, and don't make it a thing that is like taboo to talk about. Make it something that is just a part of your normal conversation, in a healthy way, not in a joking way, not in a shaming way, but in a, I truly want to understand the perspective and the experience of other people way. I think a lot of the world's problems could probably be solved if we really just tried to understand the perspective of other people and their struggles and their triumphs, and the things that are working for them and the things that don't work for them, and how they're the same from, you know, as us, or maybe different from us. And I don't think this is any different than that.
Yeah. What advice would you give to someone who's recently been diagnosed or suspects that they do have ADHD?
So I guess first I would say your symptoms are valid, whether you know, if you're still suspecting, whether you get diagnosed with ADHD or not, your symptoms are valid and they're real. After that, then I would say really make sure that you're looking at neurodivergent affirming places to get services. So whether that's therapy, whether that's your pediatrician, whether that's tutors, like whatever that is, make sure that they're neurodivergent affirming, because otherwise you're just gonna go get invalidated, and that's not gonna help, right? So look specifically for people who've got training in this area, or who maybe have lived experience in this area, but people who are going to understand and are not going to try to make you fit into their box, right?
So how do you think that ADHD awareness has evolved in recent years, and what do you think still needs improvement? Because this goes back to the question where I asked you how people can reduce stigma about it, and you said to just talk about it. So do you think that that's like improved more in the years, like in the past few years? Like more people, I know that more people online, like on social media, have been talking about it. But other than that, do you think that it's been improving?
I think it's definitely improving. And I think that the only thing that I would really like to see with, with people talking about it online is really talking about the differential diagnoses, because that's the one thing that I see that is really hard for people is when they are absolutely sure that this is their diagnosis because their friends have this diagnosis and they saw it online and they have all those symptoms too. It can be really hard for people to then not get that diagnosis if they don't actually have it, because it feels like someone's invalidating their symptoms. And that's, we've talked about that a lot today.
Yeah.
That's not what it is, but I can certainly understand how it feels that way when somebody is really convinced that this is the only explanation for the symptoms that they're having. So I think we're doing a really good job about talking about it more. The area I think we're not doing a great job in is talking about all the other things that could also cause those symptoms, right? And so if we're gonna do more education on social media, more education online, I am all for that. More education is always good. But we also have to do the full education, right? Like we have to talk about all of it. So I think that's the area that I think we could improve in.
So that's all the questions I have for you today. So thank you so much for answering all these questions. And I really hope that whoever is watching, they learn a lot more about ADHD. Like symptoms, they can be for like different things, not just like for one thing that they think it is. And like you said, education is really important. So hopefully people can continue learning about this.
I hope so too.
Thank you.
Thank you.